Hey, thanks for joining Dr. Wood and I for a chat. We're talking about perimenopause. You may have heard of menopause, but this one's perimenopause. So what's it all about?
So perimenopause is this time for a few years before you reach menopause, and it basically affects all women who eventually get to menopause.
Right. What age?
Oh, well, menopause happens between 45 and 55.
Okay.
And so perimenopause happens a few years before menopause actually happens. And it's usually highlighted by periods becoming irregular, sometimes associated with quite heavy bleeding.
Right.
Might start having some mood swings.
Okay, so we're talking about the symptoms here.
The symptoms.
So look out for these symptoms.
Right.
Heavy bleeding,
mood swings. So if your partner's kind of looking at you going, what's going on with you today? You know, maybe you've got to think
that
about...
was normal after you have a baby.
It could be. But perimenopause is basically this time when your body's starting to change and get ready for this next section of your life.
Right.
100 years ago, menopause didn't exist because women died when they were 50, 55.
Okay.
And now women are expected to live till they're 90. And so, and you're meant to work all this time. So menopause has become a big part of women's lives now. So we have to work out ways to help women during this change.
Yes.
So if
we're looking out for these symptoms, what do we need to do to look after ourselves and prepare for our...
The cause of it all is that your ovaries have run out of eggs now, right? And when the ovaries run out of eggs, that's the key for menopause to kick in, and so your hormones are changing.
Yeah.
And when that happens, some changes may happen to your body. So if you're having...
So every woman will get this?
Yeah, some worse than others. Some people just breeze through it like there's no problems. Some women, it's diabolical.
Right.
And so if you're having really big problems with heavy bleeding, then maybe you need to see your doctor and get some advice on how to treat that. There's many simple things that can be done that don't require surgery.
Okay.
If you're having trouble with your moods, if you're having trouble with hot flushes, if you're having trouble with all these things, these changes, and it's not just the fact that it's been really hot in Sydney the last few weeks, but if it's happening all the time, then these are keys or cues that things may need to be attended to, and so you can see your health care practitioner.
Yeah, don't ignore these symptoms.
Exactly right, yeah.
Don't listen to your body. So important for us, because we're so busy looking after our families, working and all the rest of it, that sometimes we forget to listen to our own bodies. So
that's right.
Take note of these symptoms that you're talking about.
Yeah. And there is help out there if you need it. And some people really suffer. Some people there's no problem, but some people really are debilitated by these symptoms.
Wow.
So you don't need to suffer in silence. Get some help. There's plenty of good options for you.
Thank you so much, Dr. Wood, for that. Now, there you have it. Great tips for you to take note of. Keep it locked right here for this and more Mums at the Table.